Welcome back to Med Madness, the podcast where we explore essential topics in medical education and practice. I'm your host, and today we're diving into the critical topic of medication safety. In this episode, we'll focus on dosing miscalculations and strategies for improving medication administration safety. We'll conclude with a case study to illustrate these concepts in action. Let's get started. Dosing miscalculations are a significant source of medication errors in healthcare. These errors can lead to serious and sometimes fatal consequences, particularly when administering high-risk medications such as systemic intravenous anticoagulants like heparin and tissue plasminogen activator. One of the main challenges in dosing these medications is the complexity of the calculations required. Different anticoagulants often need weight-based dose calculations which can vary in units, for example, mg, kg, mcg/kg/min, mg/m2. This complexity increases the potential for human error, especially if patient weight is not accurately measured and recorded. A common dosing error involves the use of incorrect units, such as calculating doses based on pounds instead of kilograms. This mistake can lead to significant overdosing or underdosing, with severe implications for patient safety. To address these challenges, healthcare facilities can implement several system-based strategies designed to reduce the effort required for correct dosing and minimize the risk of errors. Standardization and simplification. Standardization and simplification are crucial in reducing medication errors. For instance, standardizing equipment to display only metric units, kilograms, can eliminate the risk of confusion between pounds and kilograms. This simplification ensures that all weight-based calculations are consistent and reduces the potential for dosing errors. Computerized order entry systems. Implementing computerized physician order entry (CPOE) systems can significantly reduce medication errors. These systems automate the calculation process, ensuring that the correct dose is prescribed based on the patient's weight and other relevant factors. They can also include built-in checks for potential errors, such as dose limits and contraindications. Barcode medication administration, BCMA. BCMA technology enhances the accuracy of medication administration by requiring healthcare providers to scan barcodes on both the patient's identification band and the medication. This double-check system ensures that the correct medication and dose are given to the right patient at the right time. Visual cues and alerts. Using visual cues and alerts in electronic health records, EHRs, can help draw attention to critical information such as high-risk medications or patient-specific dosing considerations. Prominent display of this information reduces the likelihood of errors during the prescribing and administration processes. Pharmacist involvement. Involving pharmacists in the medication administration process can add an extra layer of safety. Pharmacists can review medication orders for accuracy, ensure proper dosing, and provide valuable insights into potential drug interactions or contraindications. Let's illustrate these strategies with a case study from a busy urban hospital. The hospital noticed a high incidence of dosing errors with systemic intravenous anticoagulants, prompting a review of their medication administration processes. Standardization and simplification. The hospital standardized all weight measurements to be recorded and displayed in kilograms only. This eliminated the confusion between pounds and kilograms, reducing the risk of dosing errors. Computerized order entry systems. The implementation of a CPOE system automated the calculation of anticoagulant doses. Physicians entered the patient's weight, and the system calculated the appropriate dose, including built-in safety checks for maximum and minimum dose limits. Barcode medication administration, BCMA. BCMA technology was introduced, requiring nurses to scan the patient's ID band and medication barcode before administration. This ensured that the correct medication and dose were administered to the right patient. Visual cues and alerts. The EHR system was updated to include visual alerts for high-risk medications. These alerts highlighted critical information, such as patient allergies and contraindications, drawing attention to potential issues before medication administration. Pharmacist involvement. Pharmacists were integrated into the medication administration process. They reviewed all anticoagulant orders for accuracy and provided consultations on potential drug interactions and contraindications. As a result of these comprehensive changes, the hospital saw a significant reduction in dosing errors. The combination of standardization, automation, barcode scanning, visual alerts, and pharmacist involvement created a safer medication administration process, ultimately improving patient outcomes. In conclusion, dosing miscalculations can have serious consequences, but by implementing strategies such as standardization, computerized order entry systems, barcode medication administration, visual cues, and pharmacist involvement, healthcare facilities can significantly improve medication administration safety. Join us in the next episode of Med Madness as we continue exploring more aspects of patient safety and human factors engineering. Thank you for listening, and don't forget to subscribe and share this podcast with your colleagues and friends. Until next time, stay safe and stay informed.